Hi everybody, Dr. Joseph Cipriano here. Just want to let you know the next giveaway, what we're doing is going to be another $200 giveaway. This time, in order to win that $200, what we need a little help from you. So we're coming up with our new merchandise store and we need an idea, a very creative idea for a t-shirt to be put out there. So when trying to win this money for the next giveaway, I need you obviously to be subscribed to the channel, to like the video, but then also comment on what creative idea or slogan should be for the next t-shirt, or for actually the first t-shirt for the Dr. Joseph Cipriano channel. So I'm looking forward to hearing these creative ideas. Have a good one, and obviously the most creative idea for the t-shirt will win. Enjoy the video. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, as you're telling me, the chief complaint is really, it's been the throat and everything just corresponding with the throat, with breathing, swallowing, it just feels, even I've already gone through and just pushing in all of this, everything is super tense on your entire throat, correct?
And my head also, like the jaw.
Yeah.
But then I went to the dentist and they said it's probably like the TMJ.
Okay.
That's like causing all of this.
Okay. But this has been going on for about 2.5 years now, correct?
Yeah.
Okay. And it's constant, like if you take a deep breath in.
Yeah, deep breath, like anywhere I go I feel like just paying attention.
Okay. And then the left side, correct?
Yeah, the left side, like it feels really tight and painful.
Okay. And this has all been going on for about 2.5 years, correct?
Yeah.
Okay. So, I know you guys at home can't tell just how tight and like just taut her throat is, but normal throat, you can push in, it's very, flexible, pliable. With her, it's like I'm pushing into a wall. Like everything is just very tight, and you can tell why. Even you can hear in her voice is a little bit raspy with her voice. Now this is a constant that you've been living with this for 2.5 years now, correct?
Yeah. So
hard to breathe, at times even hard to swallow, and then you feel all that tension in your head. And I can even tell just with you trying to turn and look at me, you've got to turn the entire body.
It's like really painful also, my chest.
Okay.
And then this part always cracks all the time.
Okay.
Yeah, like when I turn left and right, it's like painful.
Okay, so as you guys can tell, she's definitely going through quite a bit. What I'm going to have you do, I just want to go through some ranges of motion. So I'm going to have you look all the way up at the ceiling for me. Is that painful with that?
Yeah, I feel pain right here.
Okay. Now if you were to look all the way down at the floor, any issues with that?
No.
Okay. Bring one ear to one shoulder.
Yeah, I feel tightness right here.
Okay, and then the other side for me.
Yeah, same thing.
Okay, and then rotate over either side.
Yeah, I feel tightness, the same area right here.
Okay, and then the other side?
Yeah, same thing also, like right here the shoulders, lower neck.
Okay. Now you've gone to like your primary care physician, medical doctors, and neurologists even.
Yeah, and I even went to the hospital, and then they don't know how to like diagnose me.
Okay, so you've had your thyroid checked out, and that's completely...
Well, actually the thyroid, they're like cysts, but they said it shouldn't be causing all this tension.
Okay, so you got even a little bit now, because of exactly what's going on, that thyroid is even now having issues. So we're having some thyroid issues, neck issues, but it's just tension from your head across, your shoulders, your chest, just everything.
Yeah.
It feels like you've been almost like congested and just...
Yeah, like congested, someone's like pushing me or squeezing me constantly.
Okay. So what we're going to do today, actually I'll have you hand your glasses off. Gotcha. Alright, so I'm going to go through and I'm going to have you first lay face down for me. And then we're going to be doing some soft tissue work after we start this. So here, I'm going to guide your hand. Yep, right there. Good. And then, just let the legs relax. So we're going to start with scanning the body from that cervical spine, going all the way down to the feet, and we're going to check the symmetry from the right side to the left side. So we're going to palpate, we're just going to push in on the spine. Is any of this tender?
Yeah, the left side.
The left side, okay. We're gonna keep
Yeah,
going.
the left side hurts a lot.
Okay, so the left side is all hurting her, even through the thoracic spine. How about through here?
No.
Okay, good. And then we're going into that lumbar to the SI joints. Any pain down here?
No, but the left side before hurts where you...
Right here?
Yeah.
Okay, so it's everything left-sided that's going on. We're gonna come down, let's check the leg length out. Let's see, pull that back, there we go. So as you guys can tell, so she's pulling short on that right leg there. All right, that everything is so tight, we're gonna start off with that hypervolt. We're gonna relax everything, and then we'll start with the adjustments. How does that feel?
It feels good.
Okay, good. Alright, so we're going to start off with the adjustment. Now, this is her first time ever getting adjusted. So this will definitely be a little bit of almost a shock, but you'll definitely notice a difference here. So we're going to start with the T1 on the left here. Drop down to T2 on the right. There we go. Okay. I want you to take a deep breath in and exhale out. One more time, deep breath in, exhale out. Good. So recheck that leg length. Closer, which is a good thing. Still pulling short just a little bit on that right side. Okay. Alright, I want you to raise your right leg up as high as you can for me. Any pain, tenderness, tightness with that?
No.
Alright, relax that side. Raise the left side for me. Any pain, tenderness, tightness with that?
Yeah, tightness.
Tightness? Okay. So cross this foot over that foot for me. Good. And the table's going to come up from below. So we're going to do a P to A drop, and what's happening is, so her sacrum is pointing more towards the right side here, so we're going to do a clockwise torque to bring that sacrum back to the midline here. Go a little bit tighter with that tension. Then we're going to bend that knee. Raise that left leg up for me. How does that feel?
Yeah, it's a bit better.
Okay, so we got it feeling a little bit better, but what I'm going to have you do, just because I do feel some areas right in through here that feel a little off, I want you to sit up on the table for me, and I want you to put one leg on either side, to straddle the table.
Like,
Like that. Perfect. Okay, keep your thighs to the table for me. We're going to turn you like this. Look as far as you can over this shoulder. Yep. There we go. Good. Alright, now I want you to lay on your side and face me this way. Good. So we're going to bend that leg. There we go. Good. Flip to the other side for me. Good. Lay flat on your back. How are you feeling?
like better.
Good. Alright, so now we're going to do the leg pull. With the leg pull, you'll feel some relief in the ankle, the knees, going up to the hips. Good. Okay, I'm going to have you stand up. I'll have you stand right here for me and facing this way. Good. So we're going to now do a standing intercostal adjustment. I'm going to have you put your hands up and over mine. Yep. Lean back onto me. Squeeze your elbows together. Tighter. Good. Okay. So I'm going to have you come right here, facing the wall that way. Okay. Now we're going to do, this is called an anterior or a supine thoracic adjustment. Take a deep breath in. And exhale out. Good. That was already cleared. So I'm just going to have you relax. So now this is where you're going to feel a lot of the relief is with the Y strap here.
Okay.
This is going to decompress that entire spine, okay?
Okay.
So I'm going to have you lift your head up. Can you pull your hair through for me? Good. And just relax your hands on your stomach. Yeah, I'll have you put your hands right there for me.
Oh my God.
Relax, relax, and breathe for me.
It was a lot of cracking.
Yeah, that's why I just have you relax here for a moment. It's a powerful move.
Yeah, it's really powerful.
How would you describe that Y strap adjustment to somebody who's never had that done before?
Yeah, it's my first time. Oh, it cracks almost every like vertebrae. Yeah, it's like feels really good. Like the tension is like not there anymore.
Good.
Yeah.
All right, so I'm gonna have you sit up.
I could breathe better too.
Did you notice that already?
Yeah.
Good. Good. I want you to, I'll have you turn and face this way for me. So I know right in the beginning when you came in, you're having pain, like looking down, looking up.
Yeah.
I'll have you go do that again for me. Look up, look down. How are things feeling?
Yeah, it's better, but then I still feel like some pain.
What I'm
still
gonna
there.
correct. What I'm gonna do, I want to go through, and just because you've been having issues even pulling from the chest and everything, so we're gonna do the hypervolt, and I'm gonna come across the chest. I'm gonna go through some ranges of motion of the arm, and we're gonna use the hypervolt. I want to just relax everything like this around, and then same thing on this side, all through here.
Oh, okay.
Yeah, just because I mean, this has been like 2.5 years and just felt like that pressure was coming down on you.
Yeah.
But do you feel how things even right now?
Yeah, I think it's better. I could breathe better.
Good. Good. And that was even just with the one adjustment like that, and you're already noticing it even that quickly.
Yeah.
Good. So I'm going to have you first, I want you to take this arm, put it on my shoulder. Yep. how they have
It
you
was kind of ticklish.
Okay. Now I'm going to have you bring that arm hip. Here we go. Okay, so I know originally even in the neck, so I feel like things have already loosened up a bit.
Yeah, I think it's kind of like also the TMJ like right here.
Are you noticing?
It's also causing like pain.
Okay, let's check it. So I want you to open your mouth slowly and close it and open and close it and open. Okay. Open your mouth just halfway. Lean back onto me. Now I'm going to apply pressure. Keep your mouth open, okay? Good. One more time. Okay, open. Close. Open. Close. Open. Close. One more time, open and close. Open and close. Do one pull this way. Open halfway, right there. Can you feel that?
Yeah, I felt like right here.
Yeah.
Like,
I heard the pop.
yeah, like right here is like a little bit like loose, but then right here, yeah, there's just like popping.
You feel how that? Yeah, it's gonna be a little bit different. And open and close. Open. Keep it halfway. Yeah. Okay, we're gonna do one drop on your right side. So let me. Okay, so I'm gonna have you lay on your side facing that way. So we'll have your legs bent like that. Maybe a little over. Let's see. I'm gonna just bring that down a little bit. Okay, open up, right there, and close it just a little, right there, keep it. Too late. And relax.
Oh. Yeah, I don't like feel the popping.
Relax. So don't open all the way up just yet.
Okay.
Yeah, we're gonna have you sit up. Good. So yeah, what we just did. So when I was pulling in, we pulled that jaw back up. I know you felt that like crunch, and you actually probably even heard it on camera too. And then so what was happening, it was also just pushing on a little bit here. That's why we did a light drop. Now granted, doing the drop, like a toggle drop on a TMJ, as you can tell, they're not a comfortable type adjustment. It's almost like I'm punching you in the face.
So like, pressure.
Yeah, that is the type of effect. I'm just going straight in and dropping on that. Now, definitely for the rest of today, don't try to open your mouth up like as wide as you can go. You can obviously normal talk, but yeah, don't try to stress it today.
Okay.
Let that be. Do a little bit more like lighter foods today, just so you're not like straining your jaw too much.
Okay.
No big burgers.
Yes, no burgers today. Yes, but you are good with that. And then also, which I didn't tell you as well, but increase your water today. So make sure and drink more water, and no lifting for the next day or two. Okay. So don't work on just that, because there was so much movement, especially with that the Y strap, that decompression. Yeah, your muscles are still, being kind of like getting used to where they're now pulling at, just because your body's been out of alignment for such a long time. Now that it's back into where it needs to be, your body just almost doesn't know what's going on, so it's going to try to pull it back out of alignment. But that's why I go through with the soft tissue device, and we try to relax things, because we want the muscles to not pull things out. We want the adjustments to hold and to last as long as they can. But overall, how are you feeling? Because now you've had some relief from the Y strap. We've had some jaw adjustments. Do you notice a difference with the breathing?
Yeah, I could breathe better.
Okay.
It's less congested.
Okay. How does the neck feel and the
neck feel? Yeah, it's like loose, like way better. Before it was really tight and there was a lot of pressure. But now, I could there's not that much tension anymore.
Good. And you're turning, and you're not doing as much of this where you're turning your entire body. You can.
Yeah, I don't feel any chest pain. Before there was a lot of chest pain on the left side, but then now I could move.
Good. I am glad. All right, everybody. So if anyone is ever looking to schedule an adjustment, go right to the website, drjosephcipriano.com, and I'd love to get you in here and help you as well. Have a good one, everybody.